that 8 million additional tests will be delivered to pharmacies by today. Wales had already loaned 4 million tests to England. Health Secretary Sajid Javid has pledged that the UK's supply will be tripled early next year to 300 million per month. So the message for tonight: take a test before any celebrations and kick off the new year in a cautious and sensible way. Matt Graveling, BBC News.
Now to Dr. Leyla Hannbeck. She's Chief Executive of the Association of Independent Multiple Pharmacies, which represents small pharmacies. Welcome. Thank you for joining us. So what is the picture then in supplies of the lateral flow test? We were just hearing, obviously, that yesterday the government said 8 million would be distributed. Are pharmacies now stocked up?
The supply still is very patchy and it's very sporadic. The demand is obviously very high, particularly around the new guidance from the government that people will need to be tested and do the responsible thing by getting tested before going out and celebrating. So we have about over 70% of all calls coming to community pharmacies, telephone calls, are related to lateral flow tests. And every 2 minutes, people are walking in asking for them. But unfortunately, the supply is definitely not sufficient to meet the demand.
So when you say supply is still patchy, even after the government said those 8 million tests would be distributed, is it because 8 million haven't been distributed, or is it because it's not enough?
It's not enough, and you know, some pharmacists, for example, didn't receive anything yesterday. So I have been asking around in terms of like if people have had the supply. Some pharmacists received one box, some pharmacists received 2, but some received none. So it's very patchy, it's inconsistent. And if we are, to meet the demand and follow the government guidelines, there's got to be a better organisation around this.
How would it work better in your opinion?
Well, the supply needs to be boosted up. It needs to be well organised.
And sorry to interrupt you on that. What would be the right sort of figure? I mean, as I say, it was 8 million. What would you say the number should be?
Well, it should be double or triple that in order for us to be able to manage it, because the demand is really high, particularly now around the new year, and also beginning of January, particularly when schools starting. And
Boris Johnson has said people should do a test before they go out tonight. If they're going to their pharmacies and they can't get them, you'd imagine that could lead to a bit of frustration. What are pharmacies experiencing?
A lot of stress and frustration, Joanna, because as you can imagine, we want to help people and we want to sort this out, but it's very difficult when you have to turn patients away because the supply isn't there. And also the bureaucratic burden around that, writing down the codes and everything takes a lot of time to do. So a lot of frustration and stress going on at the moment for both patients and pharmacists.
In terms of ensuring a fair distribution of what there is, would you think that maybe there should be sort of limits on what individuals are able to get, just to make sure that, one person doesn't have loads and then that means that someone else can't have any, perhaps?
Well, there are currently limits in that we are only supplying 2 packs per person. So there are limits in place, but definitely the message as well is that people, if they have tests at home, they shouldn't go to pharmacies and asking for them if they already got them. But it's the supply needs to increase to meet the demand. That should be the key priority here.
Mm-hmm. Thank you very much indeed. Happy New Year, Dr. Leyla Hannbeck. Thank you. Let's talk now.